The problems you have in your organization are exactly where you need to start. Looking at those problems and helping to define them allows you to develop champions that can go to leadership and present them. The University of North Carolina healthcare system is a typical complex academic medical center. We consist of the University of North Carolina Hospital, the clinical activities at the University of North Carolina School of Medicine.
UNC wants to innovate. They see themselves as an innovator and a leader in the healthcare space.
We were like a lot of other academic healthcare systems with a lot of information systems that didn't talk to each other. Some of the systems were in one part of the organization, other systems were within the hospital, and there was need for information out of the various types of systems. The billing system, the clinical system, and getting that information together in one location was our biggest challenge. To not be able to access the data quickly means you have a lot more increase in your personnel costs. You have to have analysts individually go through records, and that takes a lot more time. The leadership really drove the decision making. They responded by looking for a solution specifically for a clinical data warehouse. Most of the lobbying for the clinical data warehouse came from our Chief Information Officer, who was really attuned to what was going on, but it also came from the medical leadership that was involved in quality improvement projects. We had a Vice Chancellor for Health Affairs that really understood the importance of metrics, and he was a champion for the decision-making process.
We started with our health integration framework as our end-to-end view of how we go solve customers' problems in the healthcare space, and then a specific on-ramp around health analytics. Global Business Services provided the project management, governance, and the requirements, and then the specific skills to actually build out the solution at UNC.
We knew that IBM was going to provide more than just the technical expertise, but the skill in project management, the skill in defining our data governance. Those aspects of our engagement with IBM were even more critical, in my view, than the technical ones. Data comes in from multiple sources. For clinical information, the nurses, for instance, enter the blood pressure directly into the electronic health record. For business aspects, the front desk clerk may enter a CPT code or an ICD-9 code directly into their billing system. In the hospital, the physician, through CPOE, directly enters an order.
The solution allows you to aggregate all this information across all these different siloed data sources and build one common platform so that the constituents, clinical, administrative, and research, can get access to the information in a new and innovative way.
The system that we developed with IBM's help is really powerful in that it helps us to analyze and interrelate data.
So they can get new insights and knowledge on that information based on that one common platform.
For instance, some of our healthcare analytic tools that we have now allow me to see not just my individual patients, but I see my whole practice, I see my whole healthcare system, and it really changes the way that I perform my clinical work on a day-to-day basis. To me, that's really the power of the information. The business benefits for us at University of North Carolina really ranged across the span of research needs, to quality improvement and patient safety needs, to pay for performance and insurance needs. We can go through a project proposal now if somebody knows what they want in an afternoon, whereas it would take a month before. And that means for us getting more project proposals out, doing research faster, and ultimately contributing not just to information but new knowledge.